Imagine you are in pain every single day of your life. There is a drug that could help treat your symptoms, but there are some negative side effects to it. Do you think it'd be worth it? The legalization of medical marijuana has been a debate for years. Marijuana is a newer drug that could be used to help treat cancer, Crohn's disease, epilepsy, and many other illnesses, but there are side effects to it. I plan to inform my audience not only on the benefits of this new drug, but also the disadvantages. To figure out this debate, you will have to weigh the pros and cons of medical marijuana first. Not only have I done a great amount of research on this topic, but I've also had interviews with people who have actually experienced the benefits and disadvantages of marijuana. Everyone should learn about medical marijuana before they make any judgment on it. Learning about the drug could either benefit you or come at a disadvantage to you. Throughout this speech, you will learn about pain relief, side effects, addictiveness, and the amount of research done on medical marijuana. Medical marijuana is proven to help pain, but it can also create pain. While taking this drug, the patient can feel pain relief, but also side effects. With every drug, though, comes pain relief and side effects. The reason so many people want to take medical marijuana is because of the pain relief. Medical marijuana can offer pain relief for people suffering from many diseases and illnesses. According to an article written by Tricia Torrey, using this drug can help people that experience nausea, vomiting, diarrhea, cramps, itching, and even improve appetites. Some diseases it can help treat could be sleep apnea, rheumatoid arthritis, HIV, epilepsy, cancer, glaucoma, Crohn's disease, and many other diseases that cause chronic pain. A relative of mine once told me that her symptoms of fibromyalgia, a chronic disease that causes pain and tenderness to touch, and gastroparesis, a condition that affects the stomach muscles and prevents proper stomach emptying, have decreased significantly just from taking marijuana. She isn't in as much pain, and it helps with the nausea and the vomiting. I personally suffer from Crohn's disease, and after a lot of research the past few months, I found out that marijuana is a drug that could help settle the inflammation in my stomach and possibly treat all or most of my symptoms. I know most people would love to live life without pain. I sure know I would. Not only can medical marijuana help people with physical pain, it can also help with emotional pain. People who are suffering from psychological disorders such as anxiety or depression could use this drug to help calm them down. With my Crohn's comes a lot of anxiety. Marijuana could help calming me down and help me know that everything is okay. With every drug, though, comes a lot of side effects. Medical marijuana is no different. Some of the side effects, according to Mayo Clinic, include short-term memory loss, impairment of cognitive ability, lung damage, dizziness, and feeling high. Side effects are different for every person, though. Before taking this drug, the person will have to consider the short and long-term effects. A person taking this drug would not be able to drive due to the dizziness and high feeling it can create. This could be a problem for people who rely on driving every single day of their lives. Smoking this drug can cause lung tissue damage, which can create other issues for that person in the future. Lastly, having short-term memory loss and impairment of cognitive ability is just hard to live with and can cause a lot of problems. There are so many things medical marijuana can help with, but there will always be side effects. Now that you've learned about the pain relief and the side effects of medical marijuana, it'd be beneficial to know whether the drug is addictive or not. Marijuana is not exactly physically addictive, but it is psychologically. Becoming psychologically addictive is different than becoming physically addictive. Taking a drug that it has a low risk of becoming physically addictive is very important. According to many professionals, including Jack E. Henningfield, marijuana is one of the least addictive drugs out there. An article by Angela Morrow explains how medical marijuana is a safer medication than other drugs like alcohol, heroin, and even Vicodin. People can take this drug without the fear of becoming physically addictive. The only way one might consider it physically addictive is because some people experience stomach pains, headaches, and/or irritability when off of it. Many professionals believe that those side effects have to do with psychological aspects, though. Marijuana is proven to be psychologically addictive for some people. As I stated earlier, medical marijuana can help psychological disorders. When people take this drug, they aren't as nervous all the time. When they stop taking the drug, the nervousness comes back, causing them to want to take the drug again. People with psychological disorders could become very addictive, and it could have a huge impact on their lives. Overall, though, medical marijuana can only be physically addictive, and it's very unlikely for you to become physically addictive. With all the information you just found out, you're probably wondering how much research has been done on this newer drug. The information discovered so far has been very beneficial, but there are still many mysteries about this new drug. Researchers are doing a lot to get the info, but it is hard to say what could happen in the future since it is new. Medical marijuana has shown to have many great benefits so far. The research done on the drug show that it could help a lot of people. There are still people researching this drug every day to find out other uses for it. This is a big topic now, so researchers are trying to find all the information that they can. Since it is a newer drug, it's giving scientists something new to research about. There are new tests being done every single day, and new information that could help decide whether this drug is good or bad. With it being a new drug though, there isn't as much research as some people would like. In an interview with an educated relative of mine, she explained how there isn't a whole lot of research done on medical marijuana yet. Since it is newer, it's hard to tell what the long-term effects might be. Despite all the research done, it hasn't been long enough to find any of the long-term effects. The long-term effects are still a mystery, and nobody knows if the outcome will be good or bad. There is quite a bit of research though, and the long-term effects will be discovered over time. Overall, medical marijuana has a lot of pros and cons. Medical marijuana can help with pain relief. It isn't considered physically addictive, and there has been a lot of information discovered on this topic over the past few years. Despite all of this though, there are still cons to it. There are side effects, it can be psychologically addictive, and it still needs more research on all those long-term effects. Weighing all those pros and cons, is medical marijuana worth it? You are going to have to answer that question for yourself.